The Vibe at Vibe is sponsored video content brought to you by MedCity News.
Hi there, I'm Katie Adams with MedCity News, and I'm here with Wayne Grodzki, Chief Commercial Officer at SmarterDX.
Thanks for having me.
Thanks for being here. So I've heard SmarterDX leaders describe the company's technology as a AI-powered clinical intelligence platform, but AI is sometimes just reduced to a buzzword these days, so I'd love for you to really walk us through how AI is a core integral part of SmarterDX's solution.
Perfect. Well, first, again, thanks for having me. I think we actually view our technology really as AI-first technology, really more so than AI-powered. And I think that's one of the challenges that providers have had in the market is seeing all of these little acronyms after the word AI, as if all of a sudden they added a data science team and next thing you know, they've got AI. And what we're focused on is counterfactual modeling, recreating a patient journey, looking at tens of thousands of pieces of clinical data and recreating that patient journey. So 100% of what we focus on is using AI-first technology that is strictly proprietary. It's not out of the box. So it's something we've created on our own, and then we've actually now delivering that to now 35 health systems around the country.
Awesome. Well, I want to learn a little bit more about the tech. I know that you've recently launched an AI appeals tool to fight payer denials.
Yes.
And I definitely want to hear more about this because that is just such a huge challenge for the nation's providers, a huge financial problem, given payer denials. Oftentimes they feel like payers aren't willing to work with them or kind of come to the table. So how does your solution?
Sure. Well, as we're working with our clients on our Smarter Pre-Bill product, which is where cases are flowing through post-discharge, post-final bill as a QA checker to evaluate whether or not a case looks good or it needs to be reviewed by a team of CDI specialists or HIM specialists, we're consuming an immense amount of clinical data on these cases. Whether we've had a finding or not, we have now the ability to call back that clinical data and make a clinical argument supporting the case. Because remember, if it flowed through our platform and we gave it a thumbs up, it was ready to go out to the payer and the clinical case matched the documentation, which matched the coding. That was really the most important part. Now we have the ability within 5 to 10 minutes of getting a clinical appeal letter to actually have a fully well thought out clinical appeal written, including conclusions, appendix, and making it easier for the reviewer instead of having to go to a medical record and spend an hour to 2 hours of going through the record, writing the appeal, and then editing it to be able to actually turn into an editor of that letter, looking at the same clinical information with all the valid clinical arguments right in front of them that we've been able to surface through our platform, whether we had a finding in our pre-bill solution or not.
It might be too early to report on ROI your customers are seeing from that solution, but in just terms of SmarterDX's technology, I'd love to hear more about the ROI that your provider customers have seen after adopting.
We guarantee a 5-to-1 ROI with all of our customers. We guarantee it day one they start. From the first case that we identify for them, when we find a variance that they are able to compliantly make a correction on and bill correctly, that's going to have a 5-to-1 ROI tied to it. So we don't have any implementation upfront costs. We're at 5-to-1 ROI in Smarter Pre-Bill. On the Smarter Denial side, really where we're evaluating savings is how much time is it taking for them to write a clinical appeal? We're hearing an hour to 2 hours. Typically it's the sweet spot that we hear when we talk to CDI leaders, physician advisors, HIM leaders, revenue cycle leaders. That's typically the amount of time. It's also the ability to now appeal those letters on when you get that denial letter at first versus maybe having a hold appeal going out the door before you end up actually having somebody being able to author the letter. But being able to actually have that created within 5 to 10 minutes the day you get the denial letter is really going to hold those payers and is already starting to hold payers accountable because they're no longer going to get these generic appeals. They're going to get very specific case appeals.